All right, everyone. Welcome to the Wednesdays with the Doc podcast show. I am your host, Dr. Daphne, and I am so excited to be here with you all this Wednesday during Mental Health Awareness Month. And I have a very special guest with me today, someone that I go way, way back with, that I am going to introduce you all to and welcome to the show. We have Hilary Tarkington Stowers, who I will read a little bit of her bio and then we'll jump right in with our discussion today. And then she'll get a chance to talk a little bit more about herself also. So, Hilary is the founder of Holistic Health and Nutrition LLC. Prior to creating Hilary Stowers Counseling, the mental health arm of her practice, she offered individual nutritional counseling, which is where we became acquainted with each other. Her experience as a certified holistic health counselor is what led Hilary to pursue a master's degree in education with a concentration in clinical mental health counseling. Hilary believes in the mind body connection and the importance of comprehensive approach to addressing the overall well being of clients. As a national certified counselor and a board certified resident in counseling, her areas of expertise include anxiety and depression, adjustment issues, Lyme disease, plus other chronic health conditions, and the role of nutrition plays in psychological wellness. Hilary possesses a broad understanding of mental health issues and recognizes the importance of providing compassionate care. She is dedicated to creating a safe and supportive environment for clients to share, explore, heal, and grow. Hilary is also trained in eye movement desensitization reprocessing, or EMDR, which is a modality used to treat trauma. And she is also a certified grief counselor. Hilary's office is in Leesburg, Virginia, where she meets individual clients and offers telehealth sessions. When she is not working in her own private practice, Hilary serves as a fitness instructor teaching indoor cycling classes. Welcome, Hilary, to the show.
Thank you. I appreciate the introduction. It's good to be with you always.
Of course, great to be with you. I'm so excited about our discussion, which we started a little bit before the recording started. But this is Mental Health Awareness Month, and as a mental health professional, I'm really passionate about educating about mental health and what that means and how that impacts just our overall wellness and well-being. So just want to kick us off as with the first question. Just if you could share a little bit about the importance of mental health awareness, and I know that this is kind of two parts. So share about the importance of mental health awareness as well as the importance of engaging in practices to promote maintaining good mental health.
Okay, so you're right. It is a two-part question. At least that's how I view it. So the promoting mental health awareness part is going to help reduce stigma. It's going to encourage early identification and prevention, which leads to the person seeking the appropriate care. As far as good mental health, I always think of that saying about put your own air mask on first.
Yes.
I love that. To me, it allows you to perform at an optimal level. And it's just essential for emotional regulation, effective overall functioning, well-being, and it just affects how you relate to people, how you think, how you feel. It's just something that is kind of a baseline or foundational as far as being able to function. I think sometimes, especially if you think about like mothers, they often just don't even have the luxury to put themselves first because they're putting their kids first, and that's just the nature of motherhood. But I think what that can lead to ultimately in other facets of your life, whether it's like in the workplace or in a relationship, whether it's like a romantic partnership or friendship, is if you put people first all the time, it's just not sustainable. And it can lead to high function codependency. That, in case anyone isn't sure exactly what that means, it's someone who appears capable and put together, but they chronically overfunction for other people and they don't focus on their own self care. So I think the takeaway from that for me is just focusing on your own self care. So then you are better able to help others. And of course, in a boundaried way. And I believe other aspects of good mental health include your sleep hygiene. Whenever people say like, I'll sleep when I'm dead, like I don't go for that. That's like not for me at all. Like I really need to sleep. And the older I get, the more if I don't sleep, I feel like when I was in college and I had a hangover or something. Do you know what I mean? So sleep
Yes.
hygiene, of course, based on my bio, I'm going to say clean eating, exercise. I've been a fitness instructor since like 2007. Building in time to rest, it allows you to be the best version of yourself. And I think that's another thing is we are often told like rest is earned, and we need to understand that rest is necessary, rest is deserved. Um, and I just think having good mental health overall allows you to make your decisions with more clarity. And quite frankly, I think having good mental health is a form of currency. It's a form of privilege. I don't know if that resonates with you, but I just think that in a world where everyone's like prioritizing things like looks or what kind of car you drive or that kind of thing, it's like if if you have peace, if you are well rested, if you are making decisions that are aligned with the future that you want for yourself, like that's a form of privilege. That's a currency. I would rather have that every day, all day, than have some of these things that can be taken away from you in a heartbeat and really don't matter in the end.
Absolutely. And you said a few things that really connected for me. One, when you talked about putting your own mask on first, and I often use that phrasing when I'm working with clients. And we talk about the analogy of when you're on an airplane, the flight attendant, the first thing they tell you to do when they're going through the safety check is before you help anyone else, put your own oxygen mask on first, which
Mm-hmm.
I think is just a phenomenal analogy to you can't help someone else if you haven't first helped yourself. And that even applies, I think, to clinicians and to mental health professionals. Often we spend a lot of time educating others about how to take care of themselves, and we have to take that same advice also. And then the other thing was sleep.
Mm-hmm.
And I have some clients that, have some difficulty sleeping or say the same thing as you, like, I only need, 4 hours of sleep. And I'm like, but do you really? And so I have clients compare. I'll have them compare if they've gotten, say, 6 to 7 hours of sleep to a night when they only got like 3 or 4. And when they can see that huge difference in how they functioned, they're more motivated to really address the sleep hygiene. So I do a lot of talking about sleep hygiene in sessions with clients, especially when they're experiencing anxiety and depression. And so having them to compare and see it for themselves is like an eye opener for them. So those two things resonated with me. Um, I had not thought about the privilege aspect of your mental health, and that it is a privilege to be healthy and be whole and get enough sleep and be able to take action towards the type of life that you want to live. So I'm going to have to explore that a little bit more in my journaling this evening, because now it has me thinking.
Yeah, I think it's absolutely true. And I think when you look at like the ACE questionnaire, the adverse childhood experiences, like, if there's a 50% divorce rate in this country, that means every single person who's a product of divorce has a 1 ACE score. But it kind of reminds me of that is like you have a higher ACE score and that's going to impact you in life. So it's almost like, an apt comparison. It's sort of just to me kind of like an A score. Having a low A score to me is the same, or a 0 A score is very similar to having all those things associated with optimal mental health, if that makes sense.
It does. It does. And I just hadn't thought of it in that way. But now I'm like, yeah, I have to explore this a little bit more for myself.
Okay.
um,
I'm glad.
the process that I liked that. Um, so, we're talking about all things mental health. We're in Mental Health Awareness Month. And I know sometimes when folks hear the word mental health, they think of mental health and mental illness as the same thing. So sometimes I do some educating about how, they are different. So, can you, and this might be another two parts, but can you talk a little bit or share? I know you could probably share more, but share at least three things that everyone should know about mental health and mental illness.
It's tough to boil it down to just three because it's different for every person, but I do really appreciate how you distinguish the two, mental health and mental illness. And I believe that previously they've been conflated.
Yes.
So if I think about like my father is 81 years old. If you think about people generationally, like where they are age wise, or maybe if you think about people culturally, religiously, like whatever it may be, I think that, but in particular, I'll focus on age. I think that even the vernacular, the terminology that was used surrounding getting mental health help during those eras, they use terms like, oh, you're going to a quack doctor, or oh, you're crazy. Like they would say things like that. And somebody might have had something more extreme, like bipolar or schizophrenia in some cases, or alcoholism, something like that. But in a lot of cases, a woman might have had postpartum depression and she needed to be treated properly. So I think that 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 blending of it back in the day sort of set the stage. But now when I interact with younger people, it's so much more just a part of their everyday practices. Like it's so much more normalized. Oh, I'm talking to my therapist, or my therapist said this. It used to be something where it was very hush hush and nobody was talking about going to a therapist. And I find that a lot of people I work with, I mean, even people who are in my age demographic, they'll be like, oh, I told my sons that we talked about this in session today. And I like that. I want people to be really open about it, because I'll get back to your original question of what are the three things. I'll say the first one is mental health care is healthcare. And I think if people still are having trouble understanding it because of the historical uh, lines being blurred, just think about any medical problem you could have and how you would go to a doctor, a specialist, urgent care. If you're
Mhm.
struggling with something going on in your life, seeking help for that should be no different. And I think people really need to understand, you nor I, we're not trying to fix anybody. We're just trying to help people get healthier in general.
Yeah.
So that's my first one, is mental health care is healthcare. And my second one, and this is just more like timely because of what's going on in the world and technology, I want to say that AI is not a substitute for clinically trained professionals.
Yes.
I see that. Like, preach. This is, I can't tell you how many times people come to me in session and they'll be like, well, I asked AI, and I'm like, okay, I'm going to take it in, I'm going to hear what they said.
Yes.
But I'm all for podcasts, I'm all for books, I'm all for YouTube. But I think that it's critical for people to vet who they are listening to, because there's so much misinformation out there. So, for example, if you're a couple and you're having issues, you might want to look at the Gottliebs, who specialize in marital counseling. If you are dealing with narcissistic abuse, you might want to look at Dr. Romani, who specializes in that. Just really vet who you're listening to. I mean, even I heard an actual MD that I saw her on some sort of social media platform, and she was spreading stuff that was just flat out false medical information. So even if someone has credentials after their name, it's still very important to vet them. Sometimes I'll test AI and I'll say, like, for example, with Dr. Romani, I'll say, explain the concept of yellow rocking, and then it gets it wrong. And then I'll say, explain Dr. Romani's concept of yellow rocking, and then it gets it right. So I just, really want to say, for my second answer, AI is not a substitute for us. Um, and then Dr. Daphne mentioned in my intro that I'm a certified grief counselor. So I'm going to take the opportunity to use my third one to focus on grief, because I don't believe we're living in a grief literate society. I think people around us, when we've lost someone, they want us to get over it. They want us to move on. And we don't get over our loved ones the same way you get over a cold. And I learned that from David Kessler, where I received my grief training. And he's like blowing up. He's in Oprah's sphere now. He's like on Khloe Kardashian's podcast. It's crazy because he's really, truly amazing. But I just feel so lucky that I got my training with him before he, became this massive force. But you don't move on, you learn to move forward, and grief walks beside you. And I think another critical thing about grief is that you don't need to fix the person there either, just as their friend or family member or coworker. You need to bear witness to it. You're not there to cheer the other person up. If they lost their mother, their fiance, their daughter, you are not cheering them up. So I tell people, grief is not linear. Everyone grieves on different timelines. And I tell people they will judge their own grief. I should be here now. I should not be here. So I say, don't judge your own grief, and don't judge each other's grief process. And that's a lot of times, like when we see, for example, the death of a child, we'll see the parents have a higher divorce rate because the mother can't change the child's bedroom and she goes in there and cries, and the husband can't face the bedroom and all he can do is throw himself into his work. So she's judging him, how could you go back to work? He's
Mhm.
judging her, how can you not move on? You're frozen in time. And so the judgment is really what causes the fracture. So I just think it's important to learn how to be with people in grief. And we also are a society that has difficulty tolerating uncertainty and discomfort. So all these folks need to increase their distress tolerance level to support their loved ones. So those are my top three. And believe me, I could go on about how to sit with
Oh,
people in grief, but I just want to focus on that for my third one, if that's okay.
no, I am. That is totally fine, and I'm totally sure we could go on and on and on. And it's funny when you talked about this in our society not being comfortable with being uncomfortable, because that is something that I talk to clients about all the time in sessions. And sometimes we have sessions where clients have to sit in being uncomfortable and they want me to, jump over whatever that uncomfortable topic is. And I'm like, oh no, it's okay. Let's just sit in being uncomfortable for a little bit. You're in a safe space. I'm here with you. What does it feel like? And I take it further with them to ask them, what are you feeling in your body right now?
Mm-hmm.
What are your thoughts telling you? Because we don't want to be uncomfortable. We want to just jump to, being healed and all of those good things, but it's being uncomfortable where sometimes we experience the greatest growth. It's not in what's comfortable, it's in those moments of being uncomfortable that we truly grow and the healing takes place.
I'm
And
glad
then,
you said that, because there's actually, I think people are so familiar with PTSD, which by the way, I don't even believe it's a disorder because that is a natural human response to trauma. But I think people are less familiar with the concept of post-traumatic growth. And so when you go through a divorce, when you go through a death, when you go through a grave illness, like how have you found meaning? How has your life changed? How have you changed? What have you done as a result of whatever hardship you faced? And I think that what's happening now in society with everything being so quick, like Amazon, get me the package tomorrow, DoorDash,
yeah,
get me the food now, like the internet and social media and just the immediacy. That means like I want it now, so there's no waiting. And I think that is contributing to distress intolerance. And if if you come to see you in person for counseling or come to see me in person or for telehealth, I've seen the same thing you've seen, especially if it's someone who's lost a loved one. They're like, okay, I'm here at this stage in grief. I want to get here because it's, denial, anger, bargaining, depression,
yeah,
acceptance, and finding meaning, which David Kessler actually added that finding meaning as the sixth stage posthumously um, with Elizabeth Kubler-Ross. He received permission from her family to add that. But I give them a handout sometimes, and it's a grief roller coaster because it's not like, check, I'm done with this, check, I'm done with that. You
absolutely.
might be like angry 3 months after the death. Naturally, acceptance and finding meaning are going to come at the later stages in the process. But the people are so miserable from being on the roller coaster, they just want to get off.
Yeah.
But I try to
Exactly.
tell them, and I learned this from David Kessler, like the pain is a reflection of the love. The pain you are feeling is just how much you love that person.
Absolutely. When you, as you say that, I was in a session recently, and I had to explain to the person that I was working with that this is a journey. We're not on, a sprint. This is a marathon. We're not on a sprint, and sometimes it takes time. It doesn't mean that there's anything wrong. It just means that this is what your process looks like right now. And so
Mhm.
let's take the process for what it is and just take it one session, one step at a time. And I could visibly see the person just relaxing and kind of breathing a sigh of relief. I'm like, we don't have to rush through anything. Just take it one session at a time. And I think you're right. I think the way society is set up now, that we just want everything done immediately. We don't want to wait for anything.
Mhm.
um which is why Jeff Bezos is a billionaire, because he got that right with Amazon. But it doesn't work in every part of your life. And especially when you are healing from different traumas or different life challenges or coming to therapy. You said something else that I use with students when I'm teaching psychopathology class. And I
Mhm.
remind them that we are not fixing anyone. And I'm really big on language and the kind of language that we use with clients. And I'm always, telling students and talking to clients about the fact that we're partnering together to help you achieve the level of wholeness and functioning that you want. I'm not fixing anyone. You're the expert in your
Mhm.
life. You're the expert in what's happening, and I have my expertise in, different treatment modalities and interventions, and we're going to partner together. And students have really started taking hold of that. Like, we're just because we're a social worker or a licensed mental health professional, we can't fix anyone. We can work with them, and we can provide them interventions and tools, and we can partner with them to help them achieve the level of functioning that they want. And that takes pressure off of you as the clinician and off of the client. Like, you can't fix anyone.
I think that's great. I love that they get to experience you as a professor, just, how seasoned you are and how knowledgeable you are. And it takes, like you said, it takes a lot of pressure off of them because they're most of the time so young and they're like, I got to fix this. I want to make them feel better. Honestly, there are so many small things that make a difference. Like when I'm working with someone and their husband died or their child died, I say, what's his name? It's not what was his name, it's what's his name. And then I
Absolutely.
allow them to just talk about this person because sometimes they feel like they're a burden on everyone in their life. Like, oh, I every time I go out, I'm talking about him, and people are so tired of listening to me. And so, just even listening as a clinician, it's I
Yes.
used the term earlier, but bearing witness to their suffering, to their pain, and letting them tell stories about this person. And it's just honestly, I feel like it's a privilege and an honor to be able to be beside someone on their grief journey and to get to learn about this person. Sometimes they'll bring in their, obviously everyone has their phone on them, but sometimes they'll bring in like old pictures or just different things to show me who this person was, like wedding pictures or things like that. And it's so vulnerable and it means so much to me that they're willing to share that aspect of them. One of my clients, I have so much respect, had a loss, and I provided her something I got from David Kessler's training, and it's called How to Be with People in Grief. And it's probably like 25 tips. And because this person didn't want to have to explain to all these people in their circle,
Mhm.
they just handed this out to everybody. So people had a better understanding of how they could support them. It's like a few of the things on the list are follow their lead. Their grief is not about you. Validate their timing. Be present. Be willing to sit with their pain. Mirror their tone. Ask directly how you can support them. I feel like I'm a little bit 50-50 on that one because part of me is like, don't ask a grieving person to assign you a task. They're already grieving and they don't need to give you homework. um, but the other half of me is like, because I tell people just show up with the casserole or just do the thing, do whatever it is that you feel is appropriate to support them is your
Right.
love language. But then the other half of me is like, well, if someone has gotten all these dinners brought in and all these casseroles and they really need somebody to make their family breakfast, say I need a breakfast, you know. So it kind of, it just depends. You have to read the room, and it depends on the nature of the relationship with the person. But I think there's so much that we can do, and everybody is going to go through this, whether it's the death of your pet or the death of your parents through the natural course of life or
Mhm.
other methods of death. It's important, if not critical, that we all learn how to navigate this better, not just for ourselves, but to support others in our lives.
Oh, absolutely. So this then leads me to the next question, and you touched on this a little bit, but then how do you, as a clinician, support those experiencing mental health challenges or grief that's coming to your office?
Well, my first answer is it depends.
Yeah.
um, but I like what you said earlier. I tell them, you're the expert of you. And I remember being, when I went to nutrition school, because that was my basis, that was sort of my segue into this world. The gentleman who headed up the nutrition school in New York City, he used to say, you're not the sage on the stage, you're the guide on the side. And that always stuck with me. So, and another thing you said, but I'm paraphrasing, like you can't work harder than the client. So if they come in and they don't have any idea about what therapy is, I also try to do that. What do you know about therapy? Do they have experience with therapy? Do they not? if they don't have any experience, it's like, well, I've got news. I'm not, you're not going to walk out of here healed. So I'm like, what are your goals? I ask them, what are their goals? I ask them, what do you want your life to look like?
Mhm.
Um, I said to you before we teed this up, sometimes I'm dealing with people, most of the time women who have been caregivers to their children who are now maybe teens or in college or young adults. And now they've got elderly parents who they might be providing caregiving for. So they're sort of in this sandwich generation and they might still be working full time. If I say to them, like, what do you want? They might just break down in tears because no one has asked them what they wanted. And so therefore they haven't had the luxury to think about what they wanted. Um, so I think we as clinicians really try to help make sense out of something that hasn't made sense to you. And we're this objective third party who kind of has this overview. I describe it to people like it's almost like the person in their situation is a puzzle, and above them, I see all these floating puzzle pieces, and I'm just pulling the puzzle pieces down and trying to put it together. But kind of going back to the way that I was answering a question before, a person's mental health can run the gamut. Somebody could have mild anxiety or depression on the end of the continuum, all the way up to access to disorders, which are much more serious, like I mentioned, schizophrenia or bipolar.
Right.
Whatever your problem is, whatever you're suffering from, it's valid and it deserves to be heard. And I say in practice, a human's greatest need is to be seen, heard, and understood. I often hear people say, somebody else has it worse than me. I don't deserve to, talk about this. Like they are always comparing whatever problem they have, whatever it may be, to like, well, my neighbor is battling cancer or something like that. So my problem can't be that big. I'm like, your problem is affecting you, and so it's valid. And I remember, again, to quote David Kessler, he asked us in the training, I remember there were like hundreds of people on this training call. He said, whose grief is the worst? And everyone's like crickets. Nobody's like hitting comment or chat or anything. And he just looks at the screen and he goes, yours, yours. So everybody needs to understand we're not there to judge you compared to another client. And you shouldn't, again, it's going back to self-judgment. You shouldn't judge your problem against your sister-in-law, your neighbor. It is valid. And I just think it helps to have a neutral third party to talk to about life's challenges. And it could be anything from trying to exit a toxic relationship to navigating estrangement,
Mhm.
addressing unresolved issues from childhood that are popping up like whack-a-mole in their adult lives,
Yes.
or again, having someone witness the grief after a loss. It's just, whatever, if you hit that wall and you have issues that continue to plague you, it is helpful to have an unbiased third party to help you unpack it.
Ex- Excellent way to put that.
If
I'm
I were a
gonna.
student, would I be getting good grades right now?
Oh, you would. You used all the language, unbiased, unpacking. Oh, yes, yes. I'm gonna have to borrow a few things as I teach this summer.
Who knew school was in session with Dr. Daphne right now?
Oh, it is always in session. Great stuff, great stuff. I mean, there's so many things that I'm going to be thinking about after our episode today.
Good, good.
But you talked about nutrition, and I know that's how you and I first met. So,
Mhm.
can you talk a little bit about the connection between our bodies, our nutrition, and our mental health?
Yes, this is again exactly how I got into this field. And just for a quick backstory for those listening, so I was a certified holistic health counselor, which meant my nutrition was my focus. And I was very active. I live in Loudoun County, and Lyme disease is endemic in Loudoun County. So we would have what we call LLMDs, Lyme literate medical doctors, or LAMPs, Lyme aware medical practitioners. They would refer their patients to me. So I only worked on a referral basis, and I would help those patients relearn how to grocery shop, cook, and eat for their newfound condition. And that was like really a way that they could say, hey, I have skin in this game. Like there's something I can do. The medicine can do its part, the doctor can do his or her part, but I can take part in this. So I learned through my own Lyme diagnosis very early on the role that nutrition played in my health. Unfortunately, it was a health crisis. But I saw through the first thing I did was give up gluten And that was before I even had a diagnosis. I was seeing 2 holistic MDs in the area. And within probably 6 months, I was starting to feel better. And then after I got diagnosed and opened my own private practice for nutrition counseling, time marched on, and then I would get more like run of the mill. People referred to me just like, I want to lose weight. And it became very apparent that the weight was just a symptom. And so it would be like someone who had been sexually abused as a child and she never told anybody and was an emotional eater, or someone who maybe was in a miserable marriage and he was eating almost out of rebellion. And so the weight was just a symptom of what they had going on underneath. And at that point, I was not a therapist. I was just certified in nutrition. So I was having success with them and they wanted to refer people to me. And I'm like, I'm not a therapist. And that was my impetus to going back to school. And I just, as a 40-plus-year-old person, but I really learned through that aspect of my training how connected mental health is to nutritional health, because emotional eating is an issue with mental health. So I know I'm going to sound really kind of like 101 with this, but you are what you eat. That saying is so true. And what happens in this country is we are consuming what is called SAD, the standard American diet. And it is sad for more than one reason. And you're not getting nourished when you eat that. So when I say sad, I'm talking about like, people are going to maybe have some Pop-Tarts for breakfast. And then maybe they're going to like have some Starbucks coffee or something at 11. And then at 1 o'clock, they're going to go out to Chick-fil-A. And then at 3 o'clock, they're going to the vending machine. I don't even know if vending machines exist anymore in offices, but they're going to get a Snickers. And then they're going to go home. They're tired and they're going to order pizza. So, you're not getting nourished. And the importance of consuming like whole fruits, wild caught seafood, if you eat fish, something called non-CAFO raised animals. CAFO is either confined or contained animal feed operation. So they'll put like cows and chickens in very close quarters, and they can get really sick from the close quarters. And so they often will first inject them with hormones to accelerate growth. So it should take 4 to 5 years for a calf to become a cow. It's now taking 14 months. And then it's awful. That's why we're seeing like premature breast development in young girls and things like that. And also it's like an accelerant on estrogen dominant cancers. And then the other thing they're doing is they are injecting them with antibiotics because the conditions are, they're not clean. So you've got these byproducts, whether it's butter or milk or eggs or any of this stuff, where the animals have been pumped with antibiotics, pumped with hormones. So we're eating all of that. So we want to stay away from that kind of thing. We want to stay hydrated. There are so many people who don't drink enough water. Sleep hygiene, again, I hit on that earlier. We both hit on that earlier. And the way that our body processes food is it's going to take 0 to 1 hour to process a carb, 1 to 2 hours to process protein, and 2 to 3 hours to process fat. You want to be having healthy fats. So you want to have like avocado and olive oil, things like that. I feel like in this day and age, everyone is really pushing the protein, and that's great. Sometimes I think they might be going overboard because it's sort of like of the moment. And the carbs, I encourage people to consume nutrient-dense carbs. Nutrient-lacking carbs would be like potato chips, white rice, like anything where you're getting the carbs, but you're not getting anything from them. Quinoa or brown rice, those would be, considered nutrient-dense carbs. So essentially, if you're consuming sugar, and by the way, there's an excellent TED Talk. It's like probably 10 or 15 years old by now, but there's a pediatric endocrinologist out of California. His name is Dr. Robert Lustig, and he has a TED Talk called Sugar, the Bitter Truth. So if you're considering like eliminating sugar or, significantly reducing sugar, excellent TED Talk. But the sugar, the fast food, the fried food, highly processed food, it affects your mood, and you can be eating a ton of calories. And the reason why you're still hungry in some cases is because you're not getting the proper nutrients. So you can also experience like fatigue from being essentially nutrient depleted. And then if you have regular life stressors, which we all do, unless you're independently wealthy and living the life of Riley, it's going to make it even more difficult. So I have a few other things to say, but I don't want to, I'll step off my soapbox now. to see if you have anything you want to add to that before I go on.
No, I love the connection between nutrition and our bodies and our mental health and how everything just works together. And frequently in sessions, especially when clients are experiencing anxiety, we'll talk about their diet and I'll ask them what their nutrition is like. And I'm not a nutrition, expert. I know the basics. But then we can at least talk through, well, let's consider what you're eating and how you're eating and what that may be doing to impact you. As you were talking, it was funny. I was thinking about the fact that I get a lot of people that will come up to me and ask me like, well, what kind of foundation do you wear? Your skin looks so great. And I don't actually wear foundation,
Good for you. It is
but
looking good.
thank you. But the thing is that I watch, I as much as I can, I watch what I put into my body. So I drink a lot of water. I
Mhm.
don't drink sodas. I have cut out a lot of processed food. Like in addition to it showing up in your emotions and your mental health, it's also gonna what you eat is gonna come out and it's gonna show up in
Mhm.
those visible forms. With your skin and with your face and with other parts of your body. And one thing that I've come to learn is that how we um, how we take care of ourselves, whether it's getting dressed every morning and doing the makeup and doing the hair or whatever the grooming is, those things also impact our moods. And so when we look good, we sometimes feel good or we feel a little bit more motivated to go out and do certain things. So
Mhm.
thinking of it from that standpoint as well, of what you're eating is another form of taking care of yourself. And I forgot what I heard someone say it this way. When you have garbage going in, you're going to have the garbage is going to come out and it's going to show up in various ways in your body. They don't call it junk food for no
Nothing.
reason.
Yeah.
Exactly.
Yeah.
Exactly.
It, those are all very good points. And I want to say, I think people don't understand just how rigged our food system is because there's a term that they use with the FDA and the USDA. It's called GRAS, generally recognized as safe. So these things that are making everybody sick, these are government run agencies and they're approving them. So you could have a GED or a PhD, and if you see it on the grocery store shelf at Wegmans, you think it's okay. But these things are dangerous for different reasons. So I'll give you a few examples of them. So the brain puts out signals like leptin, which means like I'm full, stop eating, and ghrelin, just like greedy, I'm hungry, feed me. So high fructose corn syrup, which is a cheap substitute for sugar, has been proven to interrupt the brain's signals. So like if you think about what we just talked about, emotional eating, then you just turned off your satiety signal and you're just going to have a free for all. You're going to keep eating. But on the other side of the coin, like what if someone's depressed and they're eating some junk food that contains high fructose corn syrup? They might be eating, poorly, but then they're going to eat even less, because they're not being told, like their brain's not saying like you need more healthy food. It's just I don't think people understand that what you eat can actually impact the signals the brain puts out. And when you talked about anxiety, sometimes I'll treat people with anxiety or sometimes I'll treat people with ADHD. Some of these people are drinking those energy drinks, like I can't remember the brand names of all of them. It doesn't matter, but you know what I'm talking about. And I'm
Yes.
like, if we already have anxiety, you already have ADHD, why are we amping it up? We're like kicking it up a notch by consuming these energy drinks. And I picked on Starbucks earlier, but it's this culture of having these coffee drinks and then they're like super high in sugar, so you're getting sugar, you're getting caffeine, and you're getting amped. And the same thing could be said for alcohol. Like if you have someone who has anxiety and they're going to bed and right before they go to bed they're like, I just need some wine to take the edge off. They're
Hmm.
going to have their wine, it might interrupt their sleep, it might lead to them emotionally eating. And then, but by the way, those are both numbing mechanisms for people who know internal family systems or IFS, or maybe they know it by parts work. Those are firefighters. They're just like flaring up because you've got these vulnerable parts of you that you don't want to feel, you don't want to deal with, you don't want to address. So you're just going to tamp them down. You're going to extinguish them with alcohol or emotional eating. And that alcohol, the next morning, you might wake up and you might be nerve wracked Just it's I don't think people understand the correlation, the high correlation. And the best thing I can tell people to do is isolate variables. Isolate variables. So let's say you drink wine, every night of the week, then give up the wine. Just do it for a week and see, how did your sleep, get impacted or not? How did you feel in the morning? Like, if we rated your anxiety, like, the GID or GAD scale, if you
Mhm.
rated it just a 1 to 10, what was it that week? What would you compare it to the previous week? Another thing, if I go back to that term grass, that bothers me about what's allowed in our food supply, artificial sweeteners. They're the no sugar foods or products or drinks. Like, commonly people are, if they don't drink a regular soda, they might drink a diet soda. So aspartame, sucralose, saccharin, like those kinds of things, they alter your gut microbiome. And so if you have changes in gut bacteria, that influences your neurotransmitters. Neurotransmitters people think of are in the brain. The majority of neurotransmitters are in your gut. So, like, think about something like serotonin, most of which is produced in the gut, or dopamine. And consuming these artificial sweeteners can increase overall body inflammation, which is linked to mood and anxiety. There's a woman who I really want to promote. Her name is Dr. Uma Naidoo. I think it's like Naidoo. She's associated with Harvard and Mass General. She's a nutritional psychiatrist. So this woman is like amazing. I'd love to meet her someday, but she has culinary training. She has, psychiatric training. She's like working at Harvard as a professor sometimes. And then she's at Mass General. But she is promoting the concept of the gut brain axis, and the idea or the notion that gut microbes, inflammation, and nutrition affect neurotransmitters and emotional regulation. So she combines her training in psychiatry, nutritional science, and her culinary skills to try to, like, make for people who are following her healthy eating more practical and sustainable, as opposed to being overly restrictive. Now, basically, her philosophy centers on the idea that what we eat can influence mood, anxiety, cognition, and overall psychiatric well-being, and mechanisms, like I said, inflammation, blood sugar regulation, and the gut-brain connection. So she is a person who, and this is an old saying, but food is medicine. And she does believe in that. I believe in that. And she encourages a lot of the same foods that I just spoke about, diets that are rich in fiber, minimally processed or unprocessed, vegetables, legumes, which are kind of like beans, the healthy fats that I mentioned earlier. She's very big into the omega 3s, fermented foods like kimchi. And she's trying to get people to reduce the intake of sugar and very processed foods. She also, because I don't want to misrepresent her, because she is a psychiatrist, she wants to stress to people that she's not saying this is a complete substitute.
Of
She's
course.
saying it's a complement,
Of course.
um, to evidence-based care like psychotherapy and medication when it's needed. So if anybody is interested in learning more about her, she has at least 2 books out that I know of. One is called This Is Your Brain on Food, and that one is more about like how different foods affect conditions like anxiety, depression, ADHD, sleep, and cognition. And that's all about inflammation and the gut brain connection. And her more recent book is called Calm Your Mind with Food. And that's focused more on anxiety, stress, and mental wellness being managed through nutrition and lifestyle approaches. But I can't say enough good things about her. I mean, for people who are on social media, I know she's on Instagram because I follow her on Instagram. But she, I think, is going to be on the right side of history. And she's someone who I wish I don't think she was mainstream yet, but this is kind of what I was trained in 16 years ago. So I'm just really happy that someone like her is becoming more visible, and I'll do whatever I can to promote her visibility myself.
No, that is great. I'm definitely going to do a little research on her and the books, because like you, when needed, yes, medication is fine. Even psychotropic medication, I don't promote that to my clients.
Hmm.
Like, let's try some other things first. But the idea of really feeding our bodies and our minds the things that it really needs, is something that's really important for me, especially,
Hmm.
working with clients, as you've already said, the whole foods, the fresh fruits, the fresh vegetables, quinoa, whole grains, healthy fats, and being mindful of how often, you're eating processed food. Now, I am a pizza lover, but I know that I can't eat pizza, every day. It's like a special occasion type of thing. My On
Mhm.
a regular basis, I'm feeding my mind and my body things to support the healthy life that I want to live. And I think it's important for us all to identify what a healthy life looks like for us. And it's going to be different for each person. But I think once you start there, then you can start making those decisions to eat more healthy.
Yeah, and I think it's important to note that there is a huge uptick in GI cancers. If you look at like Chadwick Boseman, if you look at James Vanderbeek, I mean, those guys are like in their 40s, I think, and they both died of GI related cancers. There's a reason for that. People are not getting, I mean, of course, there's a genetic component that I don't have any awareness of their personal family histories, but because we are adulterating the food supply, and not having enough fiber, not moving things through our system fast enough, or the way they should be moved through because of lack of fiber and all that, it is leading to, beyond what we're talking about today in the mental health and wellness sphere, it is leading to a huge increase in GI cancers. I don't have the numbers offhand, but I'm sure that's something that could be easily located, and we don't want that trend to continue upward.
Of course. I feel like we're going to need a part two of this interview, because there's so many other things that, have come into my mind to talk about exercise and mental health and, just all of the things that impact our health and wellness on that whole level. So we're going to have to schedule a part two
I would
for
love
this.
to. I would
Um,
love to. Yeah, and I'll say for my ADHD clients that I treat, they do report to me. They notice a significant difference, like whether they're on a drug for it or not, they do report a significant improvement in their symptoms when they exercise. So, whether they're running a marathon or, whatever form that takes for that individual, but I do get that consistent feedback. So for any of your listeners who struggle with ADHD symptoms, that's not something that I personally have, but I do hear from my clients that that is very helpful to them to incorporate regular exercise in their routines.
All right, there you have it. So much great information that was shared today. Thank you, thank you, thank you, Hilary.
My
Um,
pleasure.
as we close out, can you let the listeners know how they can get in touch with you, schedule a session with you if needed, or hear more of your great information?
Sure, of course. I have a Linktree account and it's Hilary with one L, Hilary Stowers. My counseling practice is Hilary Stowers Counseling. That's the DBA name. The LLC is Holistic Health and Nutrition. So the website is hilarystowerscounseling.com. And then I am on Instagram at Hilary Stowers Counseling. And then on my website, if you wanted to reach out to me, it goes directly to my own email. You could say I'd like to have a free consultation, because I do believe, and Dr. Daphne and I were speaking about this earlier, that we don't want to be 2 or 3 sessions in with a new client and have it not be a fit. So I want that person to get a feel for me, and I want to be able to determine, am I able to help this person? I'm very well networked within the therapeutic community and in the medical community. So if there's somebody who has a special issue or niche problem and I need to refer them to another therapist, I'm willing to do that too, because our goal as clinicians is to get you the help that you need, even if it's not with me. So you can use that through my website. Send me an email, give me a few dates and times that you would like to set up a call, and we can either do telephone, telehealth, or in person if you are local to the Leesburg area. My licensing is restricted to the state of Virginia right now. I'm hoping, because there's an initiative going on behind the scenes called the Compact, where we
Mhm.
will have more interstate reciprocity down the line. But for now, I'm just able to help those in Virginia. But thank you so much for having me. I really appreciate the opportunity.
No, thank you for joining us. I mean, such great information, so many things that were rekindled for me in the conversation. A few nuggets that I've taken note of with Dr. Uma and getting her books. That's next on my list. But we will have Hillary back, because there's so many more things that we could have talked about. Um,
Good,
but
good.
as we close out, and just continuing to observe that this is mental health awareness. As Hilary said, mental health is health. It is all connected. So continue to take care of yourselves, continue to focus on that overall health and wellness and well being. Thank you again, Hilary, for joining us. And I hope you all have a great rest of your day. You have been on with Wednesdays with the Doc, and let's continue to live our most healthy, best lives.